by
FiberNet, where your home stays connected always. Visit us online or call to get started today.
Hello and welcome back to Tech Connect. A happy new year. But Tech Connect remains the same, your ultimate connection to tech stories and innovation shaping the future of Uganda. My name is Tracy Ikopit. Here's what's coming up this week. Samsung Galaxy S25 Ultra set to launch in January. Apple to launch slim iPhone 17 Air. Uganda eyes fully electric transport by 2030. This week on the showcase, we bring you Lumi-Guard Health, which was founded to address dual challenges of light poverty and malaria prevention. We sat down with the founder of Lumi-Guard Health to tell us how exactly she's creating a solution to address these challenges simultaneously. Take a look.
My name is Toni Atwine and I am an electrical engineering student at Makerere University. I am the team lead and co-founder of Lumi-Guard Health, which is aiming to reduce the rates of malaria infection around Uganda and also to solve the problem of light poverty. I was inspired to start Lumi-Guard Health based on my personal experiences and also the experiences of those in my community. Many of us can attest to this, that we've been victims of malaria, or even if you're lucky enough to not have been a victim, you know someone who has gotten sick of malaria. And worse off, some people actually lose their lives to this disease. Like, we are still very vulnerable to malaria. So I saw this as a gap that needed to be addressed. And given my background in electrical engineering, I also noticed that there was a problem of light poverty. Very many communities and families still reach out for the kerosene lamps, for candles, and other inefficient and not clean sources of light. So I basically found a nexus between solving a problem of malaria and light poverty, whereby people can integrate a malaria solution into their day-to-day life. Because when it gets dark, or take for instance, there is a blackout, the first thing you reach out for is probably your phone so that you can get a source of light, or the switch, or like maybe a lamp that you have, yeah? But then some people still don't have that privilege. So that's why I saw that gap, and that's why I started Lumi-Guard Health. The tech behind Lumi-Guard Health, it's a solar-powered lamp for starters, which means that it harnesses the solar energy from the sun. We have a solar panel that comes with the lamp, and this solar panel basically, of course, is going to utilize the energy, the solar energy from the sun, and this energy is going to be stored into the lithium-ion batteries, and that energy from the lithium-ion batteries will be used to power the diffuser, which will diffuse the repellent and also the light itself. So families can charge it during the day, and they're able to use it when they don't have light. So sustainability is a very important factor for us at Lumi-Guard, because we realize that although there have been efforts to produce enough solar lamps on the market, many of them unfortunately die out really fast. So we are making our lamp in a way that it's durable and it can be used over a long period of time, and it's modular and repairable. Secondly, another very important factor and another very important thing we do to ensure sustainability is we upcycle lithium-ion batteries from laptops and computers, because there is a very big problem of e-waste in Uganda and even globally, and so we want to create a circular economy for these lithium-ion batteries so that they don't affect the environment, and it also helps to reduce the costs for the product. The primary users of our product are families in rural off-grid communities, people who do not probably have the privilege of just having light a switch away, and also our primary customers are mostly also Ugandans and malaria prevalent areas, because malaria is a problem for everyone, and so everyone needs to find a way to fight and protect themselves from it. And one of the ways that we have tried to reach out to these communities in the early stages, we have been interviewing families and finding out about what they think about the product, because we are trying to create a user-centered design for everyone. For Lumi-Guard, the way we measure impact and basically the metrics that we use, number one, we track the families, and in the sense of how much money are they actually spending on, how much money were they spending before on kerosene lamps or candles or the tin wick lamps, which are the turnovers, and how has that helped them save? How is integrating a solar lamp, the Lumi-Guard lamp, how has it helped them save in that period of time that they've adopted it? And also the malaria infections, of course. We can go to the families and find out, from the time you started using the lamp, have you seen any changes? Are you more comfortable, maybe carrying out activities even during like dark hours? And because you're protected from mosquitoes, and also you can extend your working hours. Are the children able to study for longer hours? So we also track the productivity hours. The biggest challenge that we have faced in developing Lumi-Guard is balancing affordability and functionality, because we're trying to create a product that is low cost as possible for everyone to be able to use and appreciate, but also it comes at a cost of the type of components that you're using. But then one of the ways that we're able to solve that is integrating the upcycled or recycling lithium-ion batteries, which also really helped us cut down on the cost of this product, therefore increasing its access to communities. At the moment, we are always cooking, trying to find something better to improve. So we are trying to integrate a charging module into the lamp, because we got feedback from some of the communities that even if they have light, they would also appreciate if they are able to charge their mobile phones, because some of them still have to trek long distances to reach out to people who are connected to the grid and be able to charge their phones. So we saw that as an opportunity for us to step in. So that's our next addition to the lamp. We are able to educate communities about light access and malaria prevention through, even before we give out the lamps, we're able to find out from them the effects that they've had from using kerosene lamps, from using the tin wick lamps, which I said are the turnovers, they're commonly referred to as turnovers, and also candles. So we're able to let them know that some of the effects that they face, for example, household air pollution, because some of these sources of light are very major cause of indoor household pollution. So we let them know also about how solar energy can be used as an alternative, and they don't have to suffer respiratory diseases, and how important how clean solar energy is, because we are blessed that Uganda is endowed with solar energy. We are along the equator.
Wasn't that amazing? A solar-powered light that doubles both as a light source, but also as malaria prevention. Incredible. We absolutely love to see it. Stay tuned. We go now for a short break.